So hi, hello everyone. So I am VC Sridharan, Assistant Professor from SNS College of Physiotherapy. So in this video, we're going to see about a clinical condition called mitral regurgitation. So what is mitral regurgitation? So what is mitral regurgitation? So generally, the blood flows in this heart. The blood generally flows from left atrium to left ventricle. So in this regurgitation flow, the blood flow from the left atrium to left ventricle is caused to an backflow. So due to this, next slide. So generally, first we have to know about the mitral valve, anatomy of the mitral valve. So the mitral valve's anatomy it has two cusps. So they are anterior and posterior cusps. So it is controlled by the papillary muscles, which is called as cauda tendineae. Then it is supported by the annulus. This annulus means it is a fibrous ring which supports the valve in the circular structure. So what are the causes for the mitral regurgitation? Generally, it is caused by different conditions, but majorly it is caused due to the rheumatic fever. So that's why the rheumatic heart disease conditions were caused to a mitral regurgitation. So rheumatic fever causes one of the main causes for the mitral regurgitation, and it is also caused by the mitral valve prolapse. Prolapse means it is a displacement. Then ischemic heart disease is also one of the causes, and lastly, some of the degenerative conditions, something related to the old ages. These are some of the causes for the mitral regurgitation. So what is the pathophysiology? So in the earlier videos we can already have seen about what is pathophysiology. So in this condition, first the blood leads back to the atrium. From left ventricle, the blood again backs to the left atrium. Then afterwards, left atrium and the ventricle gets enlarged according to the excessive volume. So due to the backflow of the blood, the enlargement of the atrium and the structure of the atrium and ventricle gets into enlargement. So due to enlargement of the heart, it leads to an increase in the pressure in the heart, and finally it leads to the cardiac dysfunction. So what are the clinical features that we are going to see exposed by the mitral valve regurgitated patients are? So first one is dyspnea. So dyspnea is nothing but the shortness of breath, and they also have an fatigue. Then they also face it to an palpitations, and finally they also can lead to some of the major clinical feature, which is known as edema. So edema is nothing but the swelling in the ankles and feet. So one of the major and the important signs and symptoms which is seen in the every cardiac conditions is this edema. So if suppose in case the patient is affected by a cardiac disease, they can feel the swelling. We can see the swelling and swelling at the feet and the ankle level. So next, diagnosis. So generally the mitral valve is diagnosed by the physical examination. So what is the main physical examination? It's nothing but an auscultation. So during the auscultation, by using stethoscope, we can able to hear the cardiac murmur. Cardiac are also known as a heart murmur. Then by using echocardiography, we can generally and particularly we can identify at the which state and which region of the heart is infected or else gets into an affected. Then the same ECG and also cardiac X-ray. The ECG shows the what is the abnormality in the electrical events of the cardiac cycle, and then chest X-ray shows whether there is an enlargement or some kind of evidences for the enlargement in the heart region. So again, what are the now we are going to see about the complications. So what are the complications generally faced by the mitral valve regurgitated patients are? First one is heart failure. So then second, they went to the pulmonary hypertension, and then arrhythmias, and lastly they have a high risk of stroke. So what are the major and the main management for the mitral valve regurgitation is? First one is medical management. So the medical management mainly concentrated on the managing the symptoms and also helps in the reducing the heart strain. And then surgical procedure, which is known as an mitral valve repair. In this surgical procedure, the valve is repaired into a normal and the normal position. And last one, one of the major and the more prominent surgical surgical management is mitral valve replacement. It is the major surgical procedure, mainly helps in replacing the damaged valve into from a same human body to human body, or else from also another animal to the human body. So what are the key takeaways for, as an BPT student, what are the some of the key takeaways for the condition that related to the mitral valve regurgitation is? So first we have mainly we have to keynote that we have to get into as mitral valve regurgitation's pathophysiology, and as well as also the clinical presentation, and we have to get into the differentiate between some other cardiac conditions and also to the mitral valve regurgitations, their complications and impact on the patients. And then we have to generally identify what are the exercise prescription and what are the prescription which are be comprised into the cardiac rehabilitation. Finally, we have to educate the patient and as well as also the surrounding environment, people around the patient, about the lifestyle modifications and also the sedentary lifestyle what are going to face about the patients. So that's it. Thank you for this condition, and we're going to see about the next condition on the next video.